Ever wondered what happens during a stroke? It's a question that might seem a bit daunting, but it's one that we should all take a moment to consider. After all, strokes are a leading cause of death and disability worldwide. But what exactly occurs in our bodies when a stroke takes place? What triggers this sudden interruption of blood flow to the brain? And most importantly, how can we prevent it? In the next few minutes, we will be unfolding the mystery behind strokes. So, what exactly is a stroke? A stroke in medical terms is a sudden interruption in the blood supply to a part of the brain. It's akin to a heart attack, but in the brain. When the flow of blood is blocked or reduced, brain cells start to die due to a lack of oxygen and essential nutrients. This can result in damage to the brain tissue. Think of it this way: imagine your brain as a bustling city, and blood vessels are the highways that deliver goods and services. When a highway is blocked, parts of the city go into a crisis. Similarly, a stroke causes a crisis in the brain. The severity and aftermath of a stroke depend largely on which part of the brain is affected and how quickly it's treated. It can lead to permanent damage, disability, or even death. Now that we know what a stroke is, let's delve into its causes. What causes a stroke? It's not as simple as you might think. There are numerous factors and conditions that can lead to a stroke, each playing a unique role in disrupting the blood flow to our brains. Firstly, let's talk about high blood pressure. As the leading cause of strokes, it's a significant player. When the blood pressure in our arteries is consistently too high, it can damage the vessels, making them prone to rupture or blockages. Next on the list, we have smoking. Yes, those puffs of smoke are more than just harmful to your lungs. Smoking accelerates clot formation by thickening your blood and increasing the amount of plaque buildup in the arteries. This double whammy significantly increases the risk of a stroke. Now let's discuss diabetes. High blood sugar caused by diabetes can, over time, damage the blood vessels, making them susceptible to clots. It's also worth noting that people with diabetes often have high blood pressure and are overweight, two conditions that independently increase stroke risk. High cholesterol also plays a villainous role in stroke causation. Too much cholesterol can lead to the formation of plaques in your arteries. These plaques can narrow the arteries or break off, causing clots that block blood flow to the brain. Apart from these, there are also lifestyle factors that can contribute to stroke risk. These include a lack of physical activity, obesity, heavy drinking, and the use of illicit drugs. Each of these factors can independently heighten stroke risk, and in combination, they can have a compounding effect. But remember, these causes are not standalone. They often interplay, creating a web of risk that can culminate in a stroke. For instance, high blood pressure might be exacerbated by obesity, while smoking might further raise the risk of clots in someone with high cholesterol. Understanding the causes of stroke is crucial, but it's equally important to recognize the types of strokes. As we progress in our conversation, we'll delve into the different types of strokes and how they impact the body. This knowledge will empower you with the ability to recognize and respond promptly to a stroke, potentially saving a life. Stroke is not a one-size-fits-all condition. There are actually several types. Let's delve into the three main types of stroke: ischemic, hemorrhagic, and transient ischemic attacks, often referred to as TIAs. First up, we have ischemic stroke, the most common type, accounting for approximately 85% of all strokes. This stroke occurs when a blood clot obstructs the flow of blood to the brain. The clot can either form right there in one of the arteries supplying blood to the brain, a condition known as cerebral thrombosis, or it can develop somewhere else in the body and travel to the brain, a scenario termed as cerebral embolism. Next, we have hemorrhagic stroke, which is less common but far more deadly. Accounting for about 15% of all strokes, this type happens when a blood vessel in the brain ruptures or leaks. Subarachnoid hemorrhages and intracerebral hemorrhages are the two main types. The former occurs when an artery on or near the surface of the brain bursts and spills into the space between the surface of your brain and your skull, while the latter happens when a blood vessel bleeds into the tissue deep within your brain. Lastly, we delve into transient ischemic attacks, or TIAs. Often referred to as mini-strokes, TIAs are temporary blockages of blood flow to the brain. They typically last less than 5 minutes and don't cause permanent damage. However, they're considered a serious warning sign of a future stroke and should not be ignored. So to recap, ischemic strokes are caused by blockages or clots, hemorrhagic strokes are caused by ruptures or leaks, and TIAs are essentially short, warning strokes with no lasting damage. Each of these types has its own unique characteristics and implications for treatment. Each type of stroke presents its own unique symptoms, which we will discuss next. How can you tell if someone is having a stroke? The symptoms might surprise you. Stroke symptoms can indeed be quite varied and depend on the area of the brain that's affected, but there are some common signs that you should be aware of. One of the most prevalent symptoms is a sudden numbness or weakness in the face, arm, or leg, particularly on one side of the body. This numbness can be accompanied by an inexplicable and sudden severe headache, often described as the worst headache of one's lifetime. Another common symptom is confusion, which may be coupled with trouble speaking or understanding speech. This isn't just forgetting a word here or there, it could be slurred speech or an inability to find the right words to express simple thoughts. Next, we have vision problems. This can occur in one or both eyes, resulting in blurred or blackened vision or double vision. These vision disturbances can occur suddenly and without any apparent reason. Another telltale sign of a stroke is trouble walking, accompanied by dizziness, loss of balance, or lack of coordination. A person experiencing a stroke may stumble, have sudden dizziness, loss of balance, or coordination. Lastly, a sudden severe headache with no known cause can also be a symptom of a stroke. This is not your run-of-the-mill headache. It's often described as the worst headache of a person's life, occurring swiftly and without any discernible cause. It's crucial to remember that these symptoms can occur individually or in combination, and they often occur suddenly. The key word here is sudden. If you or someone else experiences any of these symptoms, it's imperative to seek immediate medical attention, even if the symptoms seem to fluctuate or disappear. Time is of the essence when dealing with a stroke. The sooner medical treatment is received, the better the chances of reducing the damage caused by the stroke. Recognizing these symptoms can be a matter of life and death. Now, let's discuss how strokes are treated. Stroke is a medical emergency, but how exactly is it treated? This is a question that many people ask, and rightfully so. The treatment of stroke is multifaceted, involving a combination of immediate medical intervention, ongoing medication, and rehabilitation. When a stroke occurs, time is of the essence. The sooner treatment begins, the better the chances of reducing damage to the brain and improving outcomes. In many cases, clot-busting drugs, or thrombolytics, are administered as soon as possible. These drugs work by dissolving the clot that's blocking blood flow to the brain. One of the most commonly used thrombolytics is tissue plasminogen activator, or TPA. In some cases where the clot is large or not responding to medication, a surgical procedure might be necessary. This could involve a mechanical thrombectomy, where a catheter is threaded through the blood vessels to the site of the clot and a device is used to remove it. There's also the option of carotid endarterectomy, a surgery to remove plaque buildup in the carotid arteries, which are the main blood vessels supplying the brain. Once the immediate threat of the stroke is managed, the focus turns to rehabilitation. This is a critical part of recovery, as strokes can cause a range of physical and cognitive impairments. Rehabilitation can involve physical therapy to regain strength and coordination, occupational therapy to relearn daily activities, and speech therapy to address any communication difficulties. But it's not just about the physical aftermath. Strokes can have a profound impact on mental health too. So psychological support, including counseling or support groups, can be invaluable in helping stroke survivors navigate the emotional challenges that come with their recovery. Remember, each stroke is different, and so is each person's journey to recovery. Treatment plans are tailored to the individual's needs and may involve a team of healthcare professionals, from neurologists to physiotherapists, working together to help the patient regain their independence and quality of life. Treatment options for stroke have come a long way, but prevention is still the best cure. So, take care of your health, and remember, every second counts when it comes to stroke. So we've covered a lot about strokes today. We delved into the causes ranging from lifestyle factors to medical conditions. We unraveled the types, such as ischemic and hemorrhagic, each with unique characteristics. We identified the symptoms like sudden numbness or confusion that demand immediate attention, and we explored the treatments from clot-busting drugs to rehabilitative therapies. Knowledge is power, especially when it comes to health. The more you know about strokes, the better equipped you'll be to prevent them or help someone in need.